Good afternoon. I hope everyone is doing well. I am Ashley Watts, President and CEO of the Kentucky Chamber of Commerce, and I'm very happy that you guys all decided to join us today for our first in our webinar series. You guys have obviously received the email, but we are really happy to have a webinar series starting today with our Restart Kentucky campaign. And I think it was really important for us to make sure that public health was the very first webinar that we did, and that it was the kickoff webinar to make sure that everything that we do when we're looking at safely and methodically restarting Kentucky and Kentucky's economy, that we have public health at the center of everything, because we want to make sure that all Kentuckians are staying as safe as possible. We are really thrilled to have about 1,000 participants on this call today. So I know there's been a lot of good questions that you all have submitted. When you all signed up for the webinar, you were able to submit questions, which the panelists now have. We also do have the chat function open as well. And so if you want to ask a question throughout the time, feel free to do that. We will try to get to it as we can. Thank you again for calling in this afternoon. I just want to tell you a little bit about what we're doing at the Chamber and Restart Kentucky. And over the last 5 weeks, the Kentucky business community has really just stepped up in every way possible and have been responsible corporate citizens here in Kentucky, many of which have closed their doors, of course, of no fault of their own. Many have donated the PPEs that we've been asking businesses for the last month. And it's really just been overwhelming to see the support of the business community here in Kentucky all working together to make sure that we are going to reopen as safe and methodically as possible. And so what we've done at the Chamber is we want to be a resource for you all. We have helped thousands of businesses over the last month make sure that they have access to information on unemployment insurance, on small business loans, on the various bills that have passed at the state and federal level. And now we want to make sure that we work with you all to help the state open in a methodical and safe approach. And I said, I have been the president and CEO of the Chamber for about 5 months. And it's been a pretty humbling experience to talk to business owners who've had to close or change their entire operation. And the only thing they really have to say is, how can I help? How can I help us get back on track? How can I help people that are struggling right now? And so it's just been a really proud moment for me to kind of lead Kentucky's business community the last few months and see how you all have all stepped up to the challenge of something that we have never incurred before, and how we kind of get out of this in an appropriate fashion. So with that, we are going to have 2 webinars a week starting this week. On Thursday, we have Dr. Paul Coombs, an economist that many of you all probably know, and he's going to take a deep dive into Kentucky's economy, where we were before this, where we are now, how possibly we can get out of this, and how it looks like in the future. And then next week we have 2 webinars scheduled, one with education leaders and one with hospital leaders. So I think those are kind of things that are at the forefront. I myself have a 4- and a 7-year-old, and I'm trying to work and homeschool. So I am very interested to hearing from the education leaders on how we kind of go forth and make sure that our children of Kentucky are still learning as much as possible in this remote environment. And then we all know, and I'm sure this will be a topic today, hospitals have been obviously on the front lines of this pandemic. And so we do have both rural and urban hospitals from all corners of the state next week talking about their how they have been coping with all this the last few weeks, when they may be able to start slowly reopening, and their reaction to the pandemic. So stay tuned to the Kentucky Chamber, and we'll have more information about future webinars coming up. I think we're experiencing a little bit of technical difficulties right now. We have Ben Chandler with the Foundation for a Healthy Kentucky on. We cannot see his, oh, there he is. There's Ben, perfect timing.
Technical difficulties.
I said, in the world of Zoom that we're now living in, we all have technical difficulties, and every time I hop on, especially with 1,000 participants across the state, I just cross my fingers and hope for the best. So I think we're all on board now. So this is
yeah, sorry about that. Glad I finally made it. I needed all kinds of help.
No problem, no problem. Glad you were able to join us. This is perfect. So I will now kind of turn it over to the panel and introduce them. We have now Ben Chandler with the Foundation for a Healthy Kentucky, and many of you all obviously know him from his previous role as a congressman, an attorney general, and auditor. We also have Dr. Craig Humbaugh from the Lexington-Fayette County Health Department, and I actually saw an interesting tweet early about how the numbers in Lexington are doing really well, and crediting you and your all's team for some really good work in Lexington and Fayette County. And then we also have Scott Lockard from the River District Health Department. So I wanted to make sure that we definitely had representation from both the urban setting and the rural setting. And then today we have moderating our VP of Public Affairs here at the Kentucky Chamber, Kate Shanks. And I think this is going to be a great conversation. We've had lots of questions from business leaders from across Kentucky of many are still open, many have kind of partially closed, many are planning to reopen, but really wanting to make sure that they're following CDC and public health guidelines and keeping their employees and all Kentuckians as safe as possible. So I will say no pressure, but there's 1,000 people on, and this is the highest number of participants we've had on any of our webinars in the past month. So I think it's a good sign that people are really wanting to make sure that we're keeping public health at the center of everything. And when we reopen, we do it in a very safe and methodical way. So with that, I will turn it over to Kate Shanks.
Thank you, Ashley, and thank you to our panelists this afternoon. We're really happy to have you all lending your expertise to this discussion. We do have quite a bit to discuss. We have several questions that have come in through our registrants. I already see the chat function lighting up. So if you do have questions for our participants on the call and you'd like to submit them, you can click the little chat button. We will do our best to get through as many questions as we can. And I know for the ones that have already sent questions in, your questions are on our list. So let's go ahead and get started. I'm going to start with Dr. Humbaugh today, and I want to talk a little bit about last week and some of the direction we started to get from the White House as well as from Governor Beshear on what conditions, specifically benchmarks in Kentucky, we need to hit in order to start reopening or getting it back to some sort of normal. We did get quite a bit of direction on that, and that is where a lot of our questions are coming in. And you could unmute your line if you'd like to take that question first.
Sure. Well, thanks a lot, Kate. First of all, I appreciate being here and being able to talk with all the businesses across the state about this important topic. We realize the sacrifices that have been made by all of us, we're businesses too at the health department, through this time, public health measures and physical distancing. I think your question is a really good one. I would start it out by saying that we need to let the science guide us to where we're going in terms of relaxing or easing restrictions. And I think that's part of what you've seen in the plans that the president and the governor have talked about in some of the factors, the public health factors that we need to be looking at when we're considering easing some of those restrictions. So first of all, there's obviously the numbers, okay? Are numbers going up, or numbers going down, or numbers staying the same? And then I think one of the big issues is testing availability. So this has been a challenge throughout this entire pandemic so far, all 2 months of it here in Kentucky. And it's not only a challenge for us, it's a challenge nationally to try to find enough tests to be able to test people with mild illness. I think we're testing people with severe illness, those that are hospitalized. But getting people who have milder illness tested has continued to be a challenge. I think we're going to have the ability to have a beefed up, strong public health infrastructure to be able to do thorough contact investigations and tracings. That's going to be really important as we go back to what we call the containment phase, where we have fewer cases, so that we can have a red flag or a trigger if that we see the spike is going up because of some change that we've made, in society as we're lifting restrictions. We can get into personal protective equipment, but that's going to be really important. We're going to have adequate supplies to continue to protect our first line healthcare workers, okay? And that has been a continuing issue as well. And then I would say also we need to look at treatment modalities and vaccines. Those are farther out on the horizon in terms of vaccines. And probably finally, immunity. So what's the level of immunity in our communities? And that might be different in Scott's area than it is in Lexington compared to Western Kentucky. So, and that's difficult for us to figure out right now because there is no standardized test with a specific cutoff that's going to tell us, is this person immune to disease after recovery?
Thank you. It's a great summary. Scott, other thoughts that you might have about the specific benchmarks that the governor listed, ones that really resonate with you or with your region of Kentucky? And of course, we brought up that you represent a more rural area of the state, and any specific considerations about what we're looking for in the rural parts of the state too.
Yeah, Kate, thank you. And again, we appreciate our business community so much. When I was in Winchester as the director down there, I served on the local chamber board of directors, and shout out to Cindy Banks, and just ran a wonderful chamber of commerce down there. And the best way to improve public health status is to improve socioeconomic status. So working with our businesses are very, very important. Here in the rural part of the state, it's a big challenge for us. There's a lot of differences between the urban part. I know as we look here in Kentucky River District, we have had 11 positive cases of COVID-19 so far. We've still been focusing a lot on prevention. We were really, this part of the state was some of the first to adopt more policies related to social distancing, one shopper per family in our big box stores, really working aggressively with our business community on containment. And as we see the outbreak progress across the state, we're seeing this in the nation, that the peak for one state in our country is going to be very different from the peak of this in another part of our country. Well, the same thing for here in Kentucky. Here in Eastern Kentucky, we may be running 2 to 4 weeks behind the peak in Central Kentucky. So those are considerations and factors that we need to really think about here, because we're going to think about these and the benchmarks that the White House has put out and the governor is embracing is 14 days of decline before we would consider, the phased in opening and release, easing these restrictions. Well, that's going to be different in different parts of our state. So we have to be very mindful of that and working again so we don't have outbreaks, and pop-ups of outbreaks throughout different parts of the state as we ease restrictions on another part.
Great, thank you. And Ben, at-risk populations, this is an area that we're hearing specifically about, that while we might move into a phased approach on reopening parts of our economy, that those that struggle with pre-existing conditions or in an at-risk population might need to continue taking certain precautions longer. I mean, is this an area that you all are looking at the foundation, or are there specifics in these benchmarks that you've really honed in on?
Well, first of all, let me just say that I understand that there are a lot of people out in Kentucky who are suffering now, not only the people who have contracted this illness, but the people who are suffering economically. There are a whole lot more people who are afraid, and that's understandable. And I want to compliment everybody who is working so hard to try to do their part to make sure that we get through this. And businesses are a big part of this. There's a lot of sacrifice and a lot of suffering going on in the business community right now. And it's a concern to all of us, and we're all quite anxious. I don't think there's anybody in this Commonwealth who isn't quite anxious to get back to normal and get everything up and running again. I want to agree with what Craig said and just put a finer point on it about the testing. In my judgment, we have a problem here in Kentucky that we've got to resolve before we can safely get things moving again. And that problem essentially is all around the testing issue. We have not tested very many people in Kentucky. I think there are a lot of folks who don't realize that. Our level of testing is at a much lower rate than most states throughout the country. A lot of that has to do with the testing capacity, and the governor is doing the best that he can, but he's had to try to prioritize the testing, and he's prioritized it by focusing on people who are quite ill, people who are healthcare providers and folks who are first responders. And that's understandable. But we have not yet been able to test people with mild symptoms, as Dr. Humbaugh mentioned, and people with no symptoms. And unfortunately, with this particular virus, you've got people with no symptoms and mild symptoms out there who are very likely to be spreading this virus and spreading it rapidly. As we know, it's incredibly contagious. So we have got to get a handle on that. We've got to understand who's got it and who doesn't for us to take the proper precautions to make sure that everybody's safe. And from a business standpoint, business is not going to reopen with success unless customers have confidence. Employees and customers have to be confident that when they go to a business to either work or to purchase something, that they're safe. And if they don't have that confidence, I don't think we're going to get anywhere near where we want to be. So the testing is crucial of that. We've got to ramp it up. And then in addition to that, the tracing is the contact tracing that the public health departments, really should have responsibility for, but they are woefully understaffed, and that's been the case. We have not funded our public health departments. We have fine, wonderful public health departments all across Kentucky, but we have not funded them sufficiently. So we've got a big issue there, and hopefully some of the federal money that comes in can help us. As far as at-risk populations are concerned, that's another problem that we've got in Kentucky because we're not healthy. All the statistics that we see, our smoking rate, for instance, is one of the highest in the nation. Our lung cancer rate is the highest in the nation. As a result, we've got an unusually large number of people here in Kentucky who are particularly susceptible to this disease. So we've got to figure out a way to deal with that too. And none of this is easy. But this is something, as I think everybody knows, this is something that no living person has ever experienced before. It's been 100 years since we've had something like this. And consequently, we're all trying to feel our way through as best we can. But at the end of the day, I don't think we have any choice but to rely on the data. Pay attention to the data, the science, and not the date. We've got to get it right. If we roll things out and we end up with a bigger spike later, it'll be a bigger economic disaster than we've got now.
Thank you, Ben. And I'll send this one to you, Dr. Humbaugh. I mean, you mentioned the health departments and some of the struggles that you all have. What does a really good testing program in Fayette County look like? Do we have a sense of how many we could test, how many people? And I know that would look different than in Scott's area of the state. Do we know what the target is? I know it might be hard to hit the target, but do we know what a robust testing program would look like right now?
Yeah, that's really difficult to say, Kate. But I think we certainly have to have more testing available than we've got right now. We probably, ballparking it, have a few hundred tests that we're doing a day in Lexington now. We've got a population of 330,000. We are not testing anybody who's asymptomatic by and large. And as we've talked about, most of the people that are getting tested have some symptoms. That's at least one reason they're getting tested. Many other people are getting tested because they have another risk factor, like they're elderly or they have chronic disease as well as symptoms. But I think that we're going to have to be able to test people when they're symptomatic and they're contacts of cases, pretty easily. We're going to have much easier testing of folks that are in congregate living settings like nursing homes or homeless shelters. And so in order to be able to see is the virus spreading. Does that make sense?
For sure. And Scott, maybe you can talk a little bit about one of the questions that we've gotten a lot, which is, what does reopening the economy look like? I mean, we shut it all down pretty quickly, but what we know right now is that there's no switch that we're getting ready to hit. So we're talking about a phased-in approach, and really we're kind of just talking about phase one at this point. Can you elaborate on that a little bit?
Right. I think everyone wants us to get back to normal. Well, what is normal in a post-COVID-19 environment? I think that forever this pandemic is going to change the way a lot of our businesses operate, in public health and private business. So there's not going to be a magic date that we're going to say, well, come May 15th, May 30th, oh, everything's back to normal. It's the way it was before. We're going to look at these gateways, these benchmarks that the White House and the governor are both talking about. And it's going to be a phased-in approach, a gradual releasing of some of these restrictions that have been put in place. One of the first things we talk about is healthcare, the concerns with the lack of PPE, one of the restrictions on elective procedures and chiropractors, I know are a big area of concern, dental services. So how do we, phase in and what practices can be in place that these businesses can start reopening in a phased in manner and still being mindful of the social distancing, of the avoiding mass gatherings, of if you've got a big break room in your business, how do we prevent people from congregating there? We may not be able to have our break rooms open for a while where everybody can gather together. So different things. So again, the data, we're looking at the data, and I think that the governor and his team, that's what they're going to use to really guide these recommendations. When we see these benchmarks being hit, it's going to be a phased up as we have had to really abruptly kind of shut things down. It's called a non-pharmaceutical intervention. When you've got something like this that you don't have a vaccine for, you don't have herd immunity, we have to kind of, keep people apart to keep the spread from occurring. And because COVID-19, it is just very, very deadly to certain segments of our society, increasingly. And so it's going to be a ramped up, getting back to what it's going a post COVID-19 environment. But there's going to be changes. There's going to be like talked about, screening employees, taking temperatures, doing different things. So lots of different protocols, wearing masks when you're in public to not only prevent, the spread there from one person to another, wearing masks in public, these cloth masks, it doesn't protect the one that wears it near as much as it protects others if you was to have it and be asymptomatic. So I think there's just lots of things. There's going to be more and more and more guidance coming out about this as timing, and we can start planning accordingly.
Yeah, let's stick with this topic for a while because I'm getting a lot of questions about this very topic. Let's talk about guidance for employers. It seems to be changing, it seems to be evolving, and that's what we would expect in dealing with this pandemic. So my first question is, who's the source of the most recent guidance for employers? What websites do we need to be bookmarking and checking in with regularly? Is it the CDC? Is it your local health department? Is it the state health commission department? And then two, the second question is, what are the most current guidelines? And I'm specifically getting asked about, are we taking employees' temperatures? Are we asking them to wear masks? We know the 6 foot deal, but what are the specific guidelines? And Dr. Humbaugh, I'll send this to you, and then I'm gonna have Ben weigh in on it as well.
So first of all, your first question, Kate, I think all of the above websites, but the place I go for the most scientific data and up-to-date as this evolves is the CDC website, so cdc.gov, and just type CDC COVID and it's going to get you to the right website. And then there's a whole list of guidance for businesses and small businesses, things that you should think about for preparing. The World Health Organization, you didn't mention, they also have some great guidance for businesses. Local health departments have links to places that you can get good guidance, and so does the state health department. So all the above on that. In terms of the guidance for workplaces, some of these things hopefully were already being done pre-public health measures that were put into place, these restrictions. So those include environmental controls, so frequent cleaning, obviously, and that products that you're using are just usual household products. So most of those are EPA approved for this particular virus. So it's just good frequent cleaning, okay? Especially high touch surfaces. Great opportunities for all your employees to wash their hands. So that includes breaks so that people can wash their hands, plenty of good old-fashioned soap and water, and then some type of clean paper towel. Obviously, there are other areas that we can talk about. I know a lot of people have gone to teleworking. We're teleworking, or some of you all are teleworking today. We found that half of our labor force now here at the Lexington-Fayette County Health Department is teleworking approximately. So that is a good way to physical distance. And then you talked a little bit about screening employees. So that may be something that once the restrictions are loosened and businesses start back to work, that employers may want to do, and that may include everything from asking about symptoms. Certainly employees who are sick should be staying home, and they should be advised to do that well before they come to work. But if they come to work and it's thought that they are sick, screening can be an effective way to be able to do that. As you heard from Scott, I think information about whether masks are helpful in the workplace, and the jury's still kind of out on that in the sense that, yes, they are helpful for what we call source control. In other words, if you're sick, that prevents somebody else from getting sick by wearing a mask, but it may not protect you from getting sick from your coworker. So those are all I think has to be part of what businesses are going to need to do in the future as they open up.
And Ben, is this what you were referring to when you talked about people needing to feel safe, customers needing to feel safe in order to restart? And I think you're muted if you want to unmute.
Well, it is what I was referring to. It's part of what I'm referring to, but I think anybody in business understands that confidence is such an important thing as it relates to our economy. If you're going to have an economy that's got people trading and working with each other, they've got to have confidence. And right now, the polling shows that upwards of 60% of the public is not confident at all. And that needs to be dealt with. One of the things, I think what Dr. Humbaugh was saying about these steps, certainly masks, sanitizing, figuring out a way to distance, the protocols that are associated with those things are very important. I have to go back to the testing. We've got to have a much, much more robust system of testing so that employees or employers have some idea about what employees might be sick or might be somebody who would be contagious. I would worry if I were an employer, I would worry about liability issues. And I don't know that we've seen protocols on that yet, but I think we need to have protocols on some of the liability issues. If you bring in employees and you've got a contagion in your particular business and you haven't followed protocols of one sort or another, and customers or other employees get ill, what kind of liability do you have? I think that ought to be top of mind for businesses here in Kentucky. And I'm sure a lot of businesses have thought about that. But those are the kinds of things that have to be surmounted before we can get to a place where I think people would be comfortable having any kind of a vigorous economy and businesses open to a large extent.
Thank you. And I can tell you we are working on the liability issues as well at the Kentucky Chamber, as you're not surprised, I'm sure, and we'll have some future discussions on that at another webinar. So I won't bombard you all with legal liability questions. You're lucky you're getting away with that today, but we will have more discussion on that because that is an important topic. And I did get a question from someone about HIPAA violations and can you do the temperature testing and all of that. So more to come on that. Let's talk a little bit about the role of business in a phase 1 environment or even a phase 2 environment in getting involved in the testing and the tracing. I think this was talked about. I think the governor mentioned this. It might have been Dr. Stack last Friday, that businesses will have a greater role in protecting their workforce. And Ben, you commented on this. What can we be doing now to plan? You know, we're not, maybe we haven't started the 14-day downward trend in the rate of cases, or maybe we have, but what can we be doing now? What can employers be doing now to prepare for all the steps they'll need to take to protect their workforce? Do they need to be purchasing PPE? Can they, personal protective equipment? Can they even find some of those things right now? Like what would you say, and I'll send this to you, Scott, would be like some of the most important things that businesses can be doing right now to prepare for this new world where they have a more active role in protecting public health?
Well, I think that's a great question there, because a lot of our essential businesses right now are already implementing so many innovative things. I think the increase in the use of, in retail, we've seen retail in person go down, but we've seen online sales go up. We've seen entities that have never done online sales before embracing that platform and starting to use it for the first time. We see a lot of creativity, and that's a great thing about the private sector. Is we're looking to the private sector that will have some answers and come up with these on their own. I grew up in the private sector. My dad, a family business, and we were very innovative. I've got a good friend who is the private sector in healthcare, and he says he compares it to, his small private sector entity is like a destroyer. It can move rapidly, it can respond rapidly, and the big systems and government were more like aircraft carriers. It takes a long time to turn us around. So the private community is going to respond and going to have and that's one of the things I think we want to know is, what are some good ideas that are out there in the private sector? How would they look at these things? Again, social distancing is key. If we have a work environment where previously we had people sitting 3 feet, 2 feet next to each other, how do we expand that out? How do we do something different there? How do we prevent long lines all trying to clock in at the same time if it's a manufacturing environment? How do we protect individuals? How do we reinforce hand washing? It's frequent hand washing, 20 seconds at least. Is there anything systemic in our business that is preventing people from exercising these good oral hygiene things that they need to do? Just being able to purchase PPE, we talked about that, the PPE is in scarce supply, personal protective equipment, masks, things of that nature. So small businesses may not be able to get a hold of it right now. So that's one of the things, it's got to become more available. So a lot of businesses right now, they're just really promoting, like in retail, spacing out individuals, if they're buying stuff, to check out at a grocery store, check out at a big box store. You'll notice lines there at the cash register. Having every cash register open in a big box store is very important right now, or at a grocery store, different things like that. And so for our small businesses, looking for their innovation that comes from them, I think the governor said he was looking at working with the Chiropractors Association. He wanted to know what plan they had to reopen. Don't think that we have all the answers, by no means. What plans can the chamber and the business community bring? How do you want to address this? What innovative ways do you have that maybe nobody else has even thought of up to this point?
Yeah, that's an excellent point, and that's one that I wanted to make sure we kind of drove home on this webinar, is that if you've got ideas or you've got a way to develop some protocols within your business so that you can be protective of your employees and your customers, start planning that and start putting that in place if you haven't already. And many already have, undoubtedly, that are still operating, versus waiting for specific guidelines that might come that are very specific to your type of business. And the governor did seem open to hearing from certain businesses that had been closed about their ideas. So, I think that's an important part of the discussion. Dr. Humbaugh, do you agree? And are there other ideas that you would suggest, other specifics you'd suggest businesses take a look at now?
Yes. So first of all, I think businesses, I know you guys are patient and supportive of local health departments, and we really very much appreciate that. But I know there are a lot of businesses out there that are thinking about how can we make personal protective equipment? How can we change what we're doing so that we can do that so that Kentucky can have enough? So we rely on personal protective equipment that comes from other states and even other countries like China, right? And so we need those cottage industries or industries in general to think about how do they make more personal protective equipment? How can we, as Scott said, innovate? And I'm going to go back to the science part, but are there innovations that we can make in testing and treatment for this particular disease here in Kentucky? So those are other things that I would suggest that businesses can do. The other thing I would say about businesses that, and this is a day-to-day, but we come to you daily, and we're hoping that you're going to be cooperative with us when we find a case that's in your particular business, and you all are critical in helping us identify who those close contacts are in the business setting. And of course, as you change your infrastructure and the way you do things, hopefully will limit those close contacts, right? Because part of that is telecommuting, part of that is staggered workforce. So you're limiting that, but there's still sometimes close contacts, and we need you all to help us identify those folks. So that's a very important part of case investigations and contact tracing.
Great, thank you. I'm going to switch gears a little bit and talk policy, and I think I'm going to throw this to Ben. You know, as a former, really current policy person, we work with the foundation quite a bit on a lot of different policies, and of course you were in Congress. Can you talk a little bit about what we've seen from Congress, from federal policy as well as state policies that have really helped business through this process, and what there might still need to be done right now?
Well, it's important to understand again that this is like nothing we've seen before. So Congress, just like everybody else, is kind of feeling its way through, and so is the administration, both on the federal and state levels. They've done a number of things, and I'm sure every business in the state is aware of the loan program that has recently run out of money. I think that it's a very important and helpful loan program where, of course, the loans are given to businesses, and those loans will be forgiven if the money is used to keep employees on board, to pay employee salaries and so forth. I think in the very near future, we will get some information about that, and I think that they will definitely put more money into that program. I know several businesses myself who have been left out at this point, and that needs to be done, but I do think that they will do it. Another thing that I think they've got to look at, and this goes back to the whole issue of testing and PPE, and really at the end of the day, we've got to be able to identify who's got this illness and who doesn't, because it's so contagious, and you've got to be able to identify who's got it so they don't give it to other people, and you've got to be able to contact anybody that they have exposed potentially to the problem. Consequently, not only do we need testing, we need everybody in this country, frankly, to have access to health care. They have to be able to feel comfortable in going to see their provider, and part of that is making sure they've all got coverage. And I think Congress has got to look very carefully and closely, at least for these purposes, and making sure that people understand that they can go get tested, they can go get care and not worry about what it costs, and that it's going to come out of their own pocket. Otherwise, you're going to have a chilling effect on a whole lot of people who we need to find out whether they've got this thing or not to protect everybody. One of the things that's really good news about this is, at least we think, this is a coronavirus rather than a virus like the influenza or some other viruses that mutate. We don't think that this virus is going to mutate. And as a result of that, there is a very, very good chance that we can have an effective vaccine. Now, most people think it won't happen until next year, and people are working very hard on it. But it's a ray of good hope, I think, in this whole thing, that we ought to be able to develop a vaccine that really will be effective. And that's good.
Yeah, I think we're all eagerly waiting headlines to see breakthroughs. And, you know, I know I'm for one is very impatient about it, but we do see some encouraging headlines out there on vaccines as well as treatments, and as well as looking for antibodies to see who might have immunity to the virus. So, you know, we really need to keep seeing more and more of those headlines every day. So, and some Kentucky-based companies and researchers involved in it, which is always really exciting. Scott, let's talk a little bit about the health department's role in sort of, I don't want to say regulating, but overseeing all the guidelines that businesses are facing. How important is it for businesses to comply with guidelines? I don't know if comply is the right word, but follow guidelines. And what happens if you have businesses that aren't, or even just any type of groups that are congregating that aren't following certain guidelines?
Well, in health departments, we're used to working with our business community. We have the environmental health division that does our restaurant inspections, grocery store inspections. We go out, you know, we're used to doing this and working with a lot of our business community. And now if there are calls that come in as a result of a business not following some of the recommendations out there or some of the guidelines, we go out and we try to educate. We try to make sure that our business owners, our individuals there, that they understand what the current regulations are. Again, this is a changing environment, and recommendations and guidelines are changing, and requirements are changing. And so we go out and we do a lot of education, and we seek cooperation. By no means are we wanting to be punitive to any business. These are our partners. These are important parts of our communities, and we're wanting to work together to help them to understand the importance of what they need to do. And we're there as a resource for them. In just a few rare circumstances have we had to go, you know, farther than that. Again, the vast majority of our business owners really want to just know what they need to do to comply, and how do they do that. And so we do a lot of education and work a lot with them, provide them resources. I know the question earlier about where do businesses go. There's one one website that's a central clearinghouse for all information, and that is KYCOVID19, KentuckyCovid19.ky.gov. That's the state website. It has links to the CDC, WHO, all other entities' recommendations for business. It is the most current, up-to-date source. So we're trying to educate and help our business owners and our business community understand what they do need to do to comply, why it's important for them to comply, and how if we do all this now, the quicker we all get on board, the better it's going to be in the long run for us. Hopefully the less painful overall it's going to be for everyone involved.
Great, thank you. Let's switch gears a little bit and kind of talk specific sectors of the economy that have been hit hardest, I think, by this. I want to start because we're coming up on summer, and I know my kids are asking about this. Let's talk tourism. What does tourism, and specifically outdoor recreation facilities, campgrounds, marinas, pools, what do they look like this summer? Is there a chance that we'll see some of these facilities open? I know I saw a headline yesterday where one community had already announced that they would not be opening their public pools this summer. Dr. Humbaugh, do you have any thoughts on this? Is it too soon to tell? Is there still hope for a typical summer season in Kentucky?
I do think it's too soon to tell, but I would say that feel like the science would tell us that the risk for people outdoors and being in an outdoor environment, of course, we still need to be 6 feet away from each other and practice physical distancing, but it's a lot less risk because we're not inside, we're not touching surfaces, hopefully, that other people have sneezed on. And and we do need to be getting physical exercise. So I think for all those reasons, I think there's hope, but I don't have a crystal ball about this summer.
Other thoughts, Scott or Ben, about what summer looks like?
You know, tourism, outdoor. Go ahead.
Go ahead, Scott.
Well, I start to say tourism is a very important part of the Eastern Kentucky economy here. And it is one of those things, it's like the use of our lakes. I think we've seen where, boat ramps are remaining open, for example, at Cave Run Lake, encouraging people to get out on the lake and take advantage of that. However, they are not allowed to have fishing tournaments right now, where a mass of people will all come together and see who caught the biggest fish overnight or whatever. So I think we need to change our thoughts a little bit. I think it is going to be a little different environment than what we previously see. It's not going to be a normal summer, but there's still things, if we look at it in the right way, we practice social distancing, we do these things, we're still going to be able to avail ourselves to a lot of the things that we all love and appreciate about this beautiful state.
I think Scott and Craig are both right about the outdoor activities. There's a much better chance of us being able to enjoy outdoor tourism activities than others. It's where people congregate. We're got to be very careful about whether people are able to congregate or not. We cannot, at this point anyway, allow large numbers of people to congregate, again, because of the incredibly contagious nature of this disease. That being said, I go back to something else that I mentioned, and I think it bears repeating. Whether a business can open or not is not the only thing to take into consideration. You've also got to have customers. If you're a tourism business or any other business, you've got to have people who want to stay in a hotel, who want to go to activities, tourist activities. If they don't feel safe, if we haven't constructed a system that allows people to believe that they can be safe from this contagion, I don't think it's going to work, for that reason as well as others.
I think more to come on that. We'll have to watch and wait. Might be turning my backyard into summer wonderland for my sons later this year. That should be fun. What about restaurants? So they've been hit real hard, I think, with this. Probably that's when we think about the businesses that are really being forced to shut down or greatly curtail their operations. Is there a scenario where there's a phase one approach to restaurants being able to open a little bit to where we could go out to eat, or are we looking at curbside pickup for a while? Dr. Humbaugh, any comments on that?
So, we deal a lot with restaurants. We work very closely with them, and that's an industry that's particularly dear to our hearts and important to us at Public Health, and making sure that all of us get clean water and clean food, right? And safe food. I don't know, but I think, we could conjecture that restaurants may look very different in the immediate future. And that may be patrons being screened, could be waiters wearing masks, it could be tables much further apart than they have been before, with limited numbers of people at each table.
Is this an area, though, where maybe restaurants could think through some of those guidelines themselves and maybe make some recommendations potentially to their health department, to the state, on how they might go about reopening? Is that what you're thinking, Dr. Humbaugh?
I think that remains to be seen, but things like curbside service, as you said, are already, are still occurring, and we're trying to support our local restaurants as we have been going full tilt, as you all know, pretty much almost 24/7 for the last 2 months. So we're doing a lot of ordering out from local restaurants and supporting our local restaurants here in Lexington at the health department.
We are as well. It's really kind of the highlight of the week for us. Takeout, looking through the takeout menus online. Let's switch gears again and talk about non-COVID-19 related healthcare. So, we will do another session on this specifically with our hospitals, but we do have certain types of treatment, surgical deals that aren't happening right now. We're hearing people aren't maybe accessing healthcare as much as they would. I know, Scott, you probably have concerns in your region. Ben, you've probably been following this. We're doing a lot of telehealth. I'm getting a question coming through about mental health. How are we doing on mental health right now? Mm-hmm. Ben, if you want to take this one and kind of just give a general thought on how COVID-19 has impacted other health issues in Kentucky?
Well, I'm glad to hear the question on mental health, because that's something that we're going to have to really keep an eye on. There is no question that we're essentially in a traumatic situation. Everybody is dealing with trauma of one sort or another. Again, it's something that we've never experienced before, and it's very difficult. We're likely to have all kinds of health problems that need to be watched. And again, I say that it's important that mental health things are covered by insurance, and that's one of the policy things that needs to be right on this thing. But our providers need to pay attention to the signs of mental health issues that people are confronting. One of the things that you just mentioned, it's not surprising that people are not, I mean, first of all, elective procedures have been stopped here in Kentucky in the short term. But even as we go forward, you're going to have a whole lot of people who are going to be concerned about going to a hospital that is full of COVID-19 patients. They're going to worry about whether they catch the virus or not. So again, we've got to figure out a way to make sure that the general public has confidence that they can go out and take advantage of services that are available. There's a lot of the provision of healthcare that needs to go on. Some of it will be a new normal. Some of it will see telehealth being used a whole lot more. I don't think there's any question that this is going to spur the use of telehealth in a big way in the future. And I don't think we're going to go back from that. And there are a bunch of things like that will change permanently. But as far as going to see healthcare providers, I think confidence, again, is extremely essential. And the governor, in putting together his protocols and advice that he gets from people throughout the state, I know that he would welcome any kind of thoughts and ideas that any businesses might have to try to get protocols in place that would cause people to feel safe about engaging in economic activity soon.
And Scott, you're kind of nodding your head. Do you have any?
I just want to key in on the mental health component right here, Kate. That is so important. I'm a social worker by training, and what we're going through is unprecedented. And for many of us, our work family is a big release for us. That's where we talk about things. You know, we really benefit from that socialization. We're social creatures. And so we have great concerns about, the trauma as a result, of what we're living through right now, how people process that, the depression, the anxiety, a potential increase in suicide. My health department, we're offering online training of QPR about recognizing the signs and symptoms of suicide and referring someone for treatment. Our registration, we're doing this the first time we've ever done it online, and we could do 16 people online, and it filled up within the first 30 minutes of opening it. So there's demand out there for this right now. So our business community just being mindful of this and how, taking care of their own mental health. It's so important to disengage for a while and do something else that's non-COVID-19 related. We can't consume media all the time and let this just be the focus of our lives. We have to take care of ourselves and step back. And that's real important right now.
That's great advice. Thank you. We have just a couple minutes left, and I'll give this last question to Dr. Humbaugh. We're going to be studying this for years to come, right? I mean, dissertations will be written on COVID. So I know it's a little early in the process, but from your perspective, how are we doing in managing this pandemic? Are we just barely hanging on, or are you seeing some bright spots? Is it the public's involvement in the process? Your thoughts from a public health standpoint? Yeah. How are we doing?
So there is so much that we are learning, and of course we're going to continue to learn, Kate, because it's an evolving situation, but we have already learned a ton about public health and our health departments. And we were just talking here yesterday or the day before about among the senior staff about how this pandemic has and is transforming public health and health departments. So, you know, within our own industry, so to speak, we are transforming. It's not only the telehealth and the telemedicine and teleworking, but also the policies now that we have in place for leave for our employees and the way we're handling employees and staff. And looking at what this has caused us to look at what are our essential services in public health, because we can't do it all. We're trying to successfully manage, right, a pandemic, slow cases, but we also have to think we have TB out in the community. We have other services that are rabies vaccination that are critical for people to have every single day. So how do we balance? How do we do both? And then I guess from a broader perspective, you know, we're learning too, and studies are going to be done about this, but I think that we've all come together. We have been able to cooperate and move forward. I think that's one of the ways that we've been so successful so far. We can't stop a pandemic. That's just the nature of a pandemic, but we can slow it. And I think working together with our partners, business community, other government agencies, state, local, federal, we are making a difference with the pandemic. And I think that it's important for us to have conversations like this and then be on the same page as we move forward, as we're talking about what the next steps are. So yes, so much that I could say about that, and probably so many other lessons that we're going to learn as, you know, in the future, because this isn't going to stop tomorrow, right? Unfortunately.
Thank you. That's very helpful. Ben, do you have a last comment?
Kate, can I just say that one of the chief things I think we've learned is just how important public health is. If we don't have confidence, if public health isn't working, you can see the damage that can be caused to the society as a whole. Everything can be affected by it, which we're seeing right now. We have two outstanding public health leaders in Kentucky on this webinar today, and we've got others throughout the state. We have an extraordinary public health system with wonderful, wonderful professionals all over the state. We're very lucky to have them. We just need to make sure that they're funded in the right way.
Thank you. And Ben, any last comment, or I'm sorry, Scott, any last comments you want to give?
Yeah, I would just like to say, when you're working on prevention and preventing the spread of a pandemic, you know, it's hard to say, and I'd love to have that debate, you know, 6-8 months from now, did we do too much? We may never know if we did too much, but we'll definitely know if we didn't do enough, because we'll be burying a lot of our fellow Kentuckians. And so I just applaud the business community for working with the public health community. What we're doing as Kentucky is working. We're one of the most successful states in flattening the curve and working together as Team Kentucky. We're going to get through this and get on the other side of it. So just thank you for the Kentucky Chamber's leadership with our business community and being such a valuable partner.
Well, thank you. And thank you to all of you all. Really appreciate it. This has been just a really interesting conversation to have. I think we could probably spend hours talking about this, but I know you all are busy and you got to get back to what you're doing. For our participants on the line, a couple of things I want to share. One, if we didn't get to your question today, we do have a series of webinars where we'll be covering many topics, so please join us on those future webinars. We will be posting and sharing information about that. Also, we have formed a task force of our members. There was a lot of discussion on guidelines to help businesses reopen, and of course we talked about the role of business in helping create those. The Kentucky Chamber is on top of that, and we are very active in that area. We have formed this new task force, and we will be working on how we can safely reopen or expand on some of the openings that are already occurring in Kentucky, and to do this as a partner with our public health officials and making sure we can continue to get through this. So more to come on all of that information. And with that, again, thank you, gentlemen, for joining us today, and please stay safe and healthy out there. Thank you.
Thank you. You too.
Take care.